Buddy, so in this video, I'm going to talk about a subject that's pretty important in emergency medicine and in healthcare in general, but really doesn't get talked about very much in the EMS world and EMS education, and that is antibiotics. I think that a lot of the time people in EMS are pretty uncomfortable with antibiotics just because, they're really not covered, in your education very much. And this is by no means going to be a exhaustive video. I'm really just barely going to scrape the surface of what's a pretty complex topic. But my goal with this video is just to give you guys a little bit of background on, why there are so many antibiotics and, what we're thinking about when we're, going to give patients antibiotics, and just to clear up, a couple of common misconceptions about how antibiotics work. Speaking of misconceptions, I'm going to kind of start off this video by addressing a big one that you see fairly often from a lot of lay people, but also, some people in healthcare as well. And that is the idea that there is such a thing as a, quote, strong antibiotic, end quote. And I really don't want you to think about it like that. And I'll talk about why that is in just a moment. So I think that it's really not helpful to talk about antibiotics being strong or more strong or less strong, because it kind of gives you the idea that, you have this just kind of 0 to 100 point scale, right? And something's like a level 10 antibiotic, and for a 5-point bacteria you use a 6-point antibiotic or something like that. It's really not like that, and it's more complex than that, but I hope that in this video I'm going to be able to give you guys a little bit of an idea of, where exactly, things break down when we talk about using different antibiotics. So instead of thinking about it being just, more or less strong, I want you guys to kind of think about it a little bit like this, right? So imagine we have two different types of bacteria here, right? Obviously these are, very cartoon drawings, right? But for the purpose of simplicity, I've just drawn them as being the red bacteria and the blue bacteria, right? And so imagine, if you bear with me for just a second, that for the red bacteria, we're going to use the red antibiotic, and for the blue bacteria, we're going to use the blue antibiotic. And obviously, this is a little bit ridiculous. We don't literally talk about there being red antibiotics and blue antibiotics. But my point in with this goofy little drawing is just to make the point that it's really about choosing the right tool for the job. And it's not really about something being like a bigger gun or a smaller gun. What we're going for is, for whatever kind of bacteria is causing this patient's infection, or for whatever bacteria might be causing this patient's infection, or for whatever bacteria is probably causing this patient's infection, we want to choose an antibiotic that will effectively treat that bacteria or those potential causative bacteria. And there are many different types of bacteria, and they all have different properties, and that's why we have many different antibiotics with many different properties. So I know that a handful of you might have taken some microbiology in paramedic school, and most of you will not have. Some of you might be familiar with this kind of categorization to varying degrees. It's common to describe bacteria as being gram-positive or gram-negative, and I won't really get into exactly where that term comes from, but it's a common way of sorting bacteria, because it has certain things that it tells us about the cell walls, the envelope of the bacterial cell that they have. The problem with this categorization is that there's a lot of bacteria that don't really fit neatly into the gram-positive or gram-negative characterization. So instead of having just gram-positive or gram-negative bacteria, I kind of want you to think about it as essentially being there's gram-positives, there's gram-negatives, and then you have the weird guys. And that then provides a nice segue into kind of, the big point that I want to make with this video, which is the idea of coverage. And this is really a very simple concept when you gets right down to it. Coverage just means, that for a given bacteria, an antibiotic will effectively treat an infection that is caused by that bacteria, right? So when we say, oh, well, we're looking for coverage of bacteria XYZ, what we really mean is that, we want an antibiotic that will effectively treat bacteria XYZ based on whatever properties that bacteria has. And I'm going to show you a list of kind of just the common considerations we have when we think about what kind of coverage we need for a patient who has an infection. So, as I kind of showed you on the earlier slide, if we had a patient where the infection was probably caused by gram-positive bacteria, then we would look for gram-positive coverage. If we have an infection that's probably caused by gram-negative bacteria, then we would mostly look for gram-negative coverage. Now, obviously, there's a lot more than just gram-positive and gram-negative on this slide, and that kind of gets into the little thing I was talking about on the previous slide, which is the fact that there's a lot of these bacteria that don't really neatly fall into the categorization. There are also other bacteria that may exhibit an unusually high degree of drug resistance, and so we need to make sure we pull out something that we're sure is going to effectively treat those. And so some of the big ones for that are MRSA, methicillin-resistant Staph aureus, and Pseudomonas. So these are bacteria that actually do fall neatly into the gram-positive, gram-negative categorization, but they're unusually drug-resistant organisms that tend to pop up a lot in healthcare type of settings, in hospitals and in long-term acute care facilities and in ventilator circuits and in nursing homes and that sort of places. So that's why for a lot of patients who are hospitalized or otherwise kind of in those care settings, we often will say we want to choose an antibiotic that covers MRSA or covers Pseudomonas or some combination of the two. Getting into kind of the weirder guys, there's also anaerobes, which can be within gram-positive, gram-negative, but they tend to have different properties. These tend to be bacteria that show up in places to do with the oral cavities, a lot of dental infections. For example, you want to make sure you're covering for anaerobes. You have mycobacteria, which are really pretty weird. They have a very unusual cell wall structure, so the disease they cause and the antibiotics we use are pretty different. Mycobacteria there are several bacteria that are mycobacteria, but the big ones, are tuberculosis and leprosy. You got a lot of other weird guys as well. You got mycoplasma, et cetera, right? There's a lot of different types of bacteria, and so there's a lot of different types of antibiotics. So I'm going to wrap up here by just briefly talking about a very small handful of commonly encountered antibiotics that I think you guys should know. This is very far from being an exhaustive list, and there are many, many, many more on here that you will encounter. In general, if you'd like to know more about these drugs or about other common antibiotics that we use, you can feel free to reach out to me and I'll happily talk to you about it. Just because, I have to keep the list short for the sake of keeping this video short, I've just got 6 agents that I think are important to know here. The first one is actually a combination of 2 medications. This is piperacillin tazobactam, which goes by the brand name Zosyn. You will see this a lot in the emergency department because it has a pretty wide spectrum of coverage. So this is the sort of drug that we would use if we're really not sure what's causing a patient's infection because we're still very early in the process of identifying what's going on, but we think they do have an infection and we think, it's serious enough that we need to treat them right away and make sure we're covering whatever it is. Vancomycin, it can be used for a number of different things, but the big reason that you will see that added to a regimen will be coverage for MRSA, methicillin-resistant Staph aureus. Azithromycin has a few different uses, but you will probably most commonly see that for respiratory conditions. So, for example, in community-acquired pneumonia, and then also to some extent in COPD exacerbations. Doxycycline, once again, has a few different potential uses, can be used for pneumonia, but you will often see this used for coverage of like certain, skin abscesses and soft tissue infections where we need good Staph aureus coverage and MRSA coverage specifically. And you will also see this in the treatment of most tick-borne diseases, so things like Lyme disease and anaplasmosis and ehrlichiosis and Rocky Mountain spotted fever. Doxycycline is the treatment of choice. Moxicillin is a kind of a derived from penicillin drug. You will see this used a fair amount in things like treatment of strep throat and kind of a lot of those sort of garden variety streptococcal infections. You may also encounter amoxiclavinate, which goes by the brand name Augmentin. There's a few different reasons why you might choose the combination versus amoxicillin alone, but that's also a common way you find amoxicillin. The last one I'm going to talk about, just for the sake of brevity, is cephalexin or Keflex. This one is often used for some soft tissue infections, skin infections as well, but also has pretty decent coverage of many of the common organisms that cause urinary tract infections. So you may see that used for UTIs as well. So that, in just about 11 minutes, is a little tiny bit of background on antibiotics. And if you have any questions, feel free to reach out to me.